Hi guys, I'm here with the lovely Emma today. So what I'm gonna do on her is one of my favorite treatments, which is the brows lift with toxin, which is commonly known as Botox. So Emma's not very happy with the way her brows sit and she feels a bit of heaviness on an upper eyelids. So what we're gonna do non-surgically, the best treatment to deal with that would be, as first instance, always to do the Botox to the brows with the Botox. So the way I personally do it is that I block the muscle that bring the brows down, and I intentionally leave the sides of the forehead muscle called the frontalis, these areas here, without Botox. By doing so, I activate these lateral sides, so the lift is given by the activation of the muscle. So it's not a surgical lift, so I can't decide the degree of lift that we are going to achieve. It entirely depends on how strong her muscles are, but normally it does work really, really well. And then obviously tiny bit the frown line again. Very, very careful when I reduce the frown line in brows lift treatments, because if I soften the corrugators too much, she can experience a droop of the inside of the brow. So I stay quite light in this area here, and I soften it like crow's feet as well, to make sure the muscle around the eyes, which is a circle called the auricularis oculi, doesn't compensate and activate. So it will start to kick in between 3 and 5 days. However, as I say to my clients, you have to be patient and wait the full 15 days, because that's only then it's when you're going to achieve and see the final results. The toxin lasts for about 3 months, which doesn't mean that you have the strong lift for 12 weeks. The peak of the Botox is about 6 and 8 weeks, and then the curve descends, so the muscle will start to be active again, and then it will slowly wear off. If you want to have it done again, you have to wait 3 months. You cannot have it done before 12 weeks, otherwise the risk is to develop antibodies. So the safe time to have the treatment repeated is 3 months. Okay, so what I normally do when I do the toxin, which is the Botox around the eyes, if I see any swelling, which Hema has a little bit, I stay away from this area here. So I tend not to inject here, because if I block this part of the orbicularis oculi muscle, then she's going to lose the pumping effect that this muscle has on the fluids, and these can increase the swelling. So I'll just soften everything, and by leaving this without the toxin, it just gives a very natural effect, and we avoid to increase the swelling. So in her case, I think I'm going to just lift the brows more from the center, which is the way that would just help with the heaviness. Sometimes I can just change my injection points and give a bit more lifting of the actual tail. Okay, so I'm just gonna do the brows lift on Emma. I'm gonna lift her brows more from the center to mainly help with the heaviness on the eyelids. Very painless. I use tiny needles, diabetic syringes, so it's virtually painless. So frown for me, really angry, and just relax entirely. She doesn't have a really heavy frown, which is a sign that she had Botox before, which is great. However, we just wanna make sure we relax that. Okay, so now I'm gonna go for the brows lift. So I'm gonna inject in a way that I will activate the sides of the forehead, so the lifting effect of the brows will be given by this part here that will be even more active. And relax. Okay, so soften the muscle here. Okay, that's all done. So I think you're all done. So with the toxin, you won't see anything for a couple of days. Full effect will be in exactly 2 weeks. Okay, aftercare in terms of the Botox is really avoiding to touch the area for the next 48 hours. That's the most crucial time where the toxin goes into the fibers, and that's when the complication may arise. It's when you move it around. So the muscle in the face are quite small, quite next to each other, so it'll be easy easier for the toxin to move if you do touch it before it goes exactly where it should go. So 48 hours is when I say to my patients, no exercise, no makeup, just take it easy.